Now in Augusta is an interesting market because it's so competitive. We have a lot of hospitals, given 25 county population of about 600,000 people. It's pretty unusual to have the number of health systems we have vying for that volume. So it's a very competitive market, but because of the competition, I think we've seen the cost of healthcare in Augusta is lower than what you'd expect in other markets. And I think the quality is better here. And we continually try to strive to be on the top of that heap, but we're seeing everyone else raising the bar on their services too. So I think competition's been good for the market. Regarding the competitive forces and where people are going for services, you are seeing people investing in new patient rooms, private rooms, new technologies to try to attract patients to their facilities. And I don't think that's a bad thing. I think that's a good thing.
So we're super excited to continue to meet the needs of the community and fulfill our mission by bringing on these great projects. The one project which we started this year was and finished and opened was the emergency room. So $23 million investment into emergency services, which we needed because of the space constraints we had. And in the second part of the project, we hope to get through the state certificate of need process is the burn tower and a parking garage to go along with that burn tower, which will give us much needed private rooms for our burn patients and the burn population. Of course, we have the largest burn center in the country. We get patients from across the region, and we definitely need that space to meet those needs for those patients.
Right, and I would say that just after really refining our ambulatory strategy, which we've completed in the last 2 years, we knew we needed to get out into the community where our patients live, work, and play. And we're really asking for that because the other healthcare systems in the Augusta region, the CSRA, have already done that. So if it seems like there are a lot of capital projects, that's probably true, but they're very focused on the types of care that all of the systems provide. So we've been a little bit behind the competitors or our partners in care in Augusta, and now we are opening our 4th center here in the CSRA, and we're very excited.
So you're seeing as people age, they demand more services, and they tend to be sicker than younger folks. So that's largely what's driving inpatient growth. But then there's a whole nother aspect of healthcare going on, which is shifting patients from inpatient settings to outpatient settings. And a lot of that's being done to lower the cost of care. And so you're going to see, I believe, a lot of expense on the capital side as far as construction goes on the outpatient side, much like we've done with our prompt and primary cares, which we've put up across the whole region. I think you're going to see more and more of that.
The things that drive the growth here in the area is one, the population growth that we've seen has definitely been a big part of that, and also the aging of our population have driven the need for healthcare services.
We are hiring some of the most talented physicians, and they're going to be right here in Augusta, and that's very exciting. But we're also bringing some of them out to these type of care centers, and so we'll be opening one soon in Grovetown in January, and then another one shortly thereafter. And it's really, again, providing care where the patients want it, and yet also where they're telling their physicians they want them to go. So it's all connected into one care delivery system, but a continuity of care at every level.
I think Augusta is very well supplied for healthcare. We're sometimes a little spoiled. We expect on-demand service, but overall I think Augusta is well served by all of their hospitals. And what's nice also about Augusta is you don't really have to leave town for much anything anymore. Maybe some transplant services, but for the most part we can take care of anybody right here at home, which is pretty nice for the community.